Thank you, everybody, and welcome to Practicing Compassionate Badassery. My name is Jessica Dolce. I'm a certified compassion fatigue educator, and I have worked my entire adult life, more than 20 years, with animals, including working in animal sheltering. And so I'm just really it's a privilege to be with all of you today to share some of the things that I really wish someone had told me early on in my journey with animal sheltering as a career, and things that would have made a difference for me when I was struggling. And so why don't we just jump in and get started? So in terms of some housekeeping, I love a good chat. So if you feel up to it and you want to comment, question, talk to each other, shout things out in the chat, and you have access to a keyboard, please feel free to lean heavily on that. If you have questions, type them in, unmute yourself. I'll take a break about a third of the way through for questions in case you need to pass the mic. And in terms of the workbook, theoretically, you have a PDF workbook with you. If you don't, that's not a problem. But if you do have it, just keep an eye open for slides with a red star. That's an indicator that there's a corresponding section in the workbook that relates to what I'm sharing on screen. And it will just give you a chance to take a few notes to personalize what I'm talking about so it applies to your life and can support you after today's webinar. So I just think it's always important this year in 2022 to acknowledge that a lot of us are struggling right now, and that if you're not doing okay, that is okay, that's a pretty normal response to a very challenging few years where we have had a lot of chronic stress for 2.5 years of the pandemic, plus the stress of life prior to the pandemic. And so that's really added up. Most of us are struggling under a pretty intense cumulative load of all of the stressors we've been experiencing for the last few years. And so it seems really normal to me if you are not doing so well right now. And we're not going to be able to fix everything in a 90-minute webinar, but we can begin to learn about the stressors that are specific to the work that you all are doing, and some really foundational skills that can help build our resilience and reduce our stress. And I'm going to talk about a lot of different skills and strategies today because we have very different needs, right? Some folks here have 25 years of experience in animal welfare. Some folks have 1 month. So we have vastly different needs in the room, but everything that I share is going to essentially boil down to 3 important skills for us to practice: increasing our awareness, the balance in our lives, and the supportive connections that we have, the ABCs of well-being. And so no matter how complicated it gets, it always comes down to the ABCs. So here's what I know for sure about the work that you all are doing, no matter what your role is that to work in animal sheltering takes a really unique blend of technical skill, heartfulness, compassion, and courage, or badassery, bravery, strength, to show up and be competent and caring every day for animals and people who are suffering and in need of your services. In particular, I think it takes an enormous amount of courage to show up when we cannot always fix it for everyone, and we can never predict the outcome of our efforts. And I find that to be a very confusing and painful part of our work that we don't talk about. And so we'll talk about that a little bit today. The research is pretty clear. When you work in a helping profession and you care for others for a living, it comes with a cost. And we'll talk about what those costs are later in our webinar. But I think it's always important to bring the B in of balance, and to also, really keep in mind that while the work can take away and deplete us, it also gives a lot to us. This work provides a sense of purpose and meaningfulness and a lot of joy. It's fun to work with animals. At a minimum, it's funny. There's a lot of humor in our day, I think, because of the silliness and wackiness of dealing with animals in the way that we do. So I hope that you have access to the purpose and joy of your work. And if you don't, that's what we're going to help you reconnect with today. So in order to minimize the costs and help you stay connected to the good, we have to be really intentional about the way that we do the work. And so that's what I call practicing compassionate badassery. We have to practice showing up with compassion, with a big heart and kindness, and having strength, courage, the badassery to do difficult things, right? When we put our hearts and our courage together, that's compassionate badassery. And it also takes a lot of courage and heart to show up in a way where we're not only doing our work well, but we're also taking care of ourselves and each other at the same time. So the idea of practicing compassionate badassery is really rooted in the fact that animal welfare and worker welfare are inextricably linked to each other, and they're equally important. So for those of you who have been in the work for a while, maybe you experienced this too. My kind of conditioning in animal welfare was that it was always a choice between the animals or our own needs. So we could either take care of the animals or we could take care of ourselves. And so we picked the animals and we ignored ourselves, and the costs were really high. And so what we need to shift to is a both end, that we care for the animals and we care for ourselves and each other, because we're all equally important. Our welfare matters on both ends. And that's how we can really be well for the long haul in this work. So practicing compassionate badassery, showing up, protecting our heart and showing up with courage, and that really important combination of the two means that we need to learn skills that a lot of us were not taught, and get support and make difficult choices every day, all day, to approach our work in a way that isn't just effective and ethical, but it's also sustainable, right? That's the part that gets dropped a lot when we're only taking care of the animals, right? We do it in a way that's not sustainable. And so what I'm really looking at here is not only do we need to show up with compassion and courage, we also have to show up with a lot of wisdom, right? To make these difficult choices. And often I think what we use to determine whether or not we're succeeding at the work is we judge ourselves by what we accomplish at the end of the day. And the idea of practicing compassionate badassery is really that it is just as important to consider how we move through the day as what we're getting done at the end of the day. How do you relate to yourself? How do you relate to other people? How are you responding to the challenging things that are happening all around you all day? That matters and is as important as what you get done at the end of the day. And that's a different way of approaching the work. So we're going to go over some different practices today that can help you sustain your compassion and your courage. And the first is that, A of the ABCs, increasing our awareness of how the work is impacting you as an individual. So this quote really gets to the heart of any way that we are impacted by the work. Dr. Remen wrote, "The expectation that we can be immersed in suffering and loss daily and not be touched by it is as unrealistic as expecting to be able to walk through water without getting wet. There's no way that you can work in animal welfare and not be touched by it in some way. We're all changed by what we experience in this work. The good news is we can be changed in some really profoundly positive ways. It can be a tremendous path of not just professional, but personal growth. But in order to access the good stuff, we need to have an honest conversation and awareness of some of the negative impacts of the work. So I'm going to go over a number of overlapping personal and professional factors that might be creating some stress or distress for you now or in the future. And these factors can, over time, create the conditions for you to experience compassion fatigue or burnout. So as I'm going over them, I just want you to reflect on which factors am I exposed to regularly, or what is my staff exposed to a lot of the time? And I'll go over kind of a high view, and then we'll dive into a few of these more deeply. So the first factor that we're exposed to at work is trauma. And we may be exposed to direct or indirect trauma. Another way of saying that is primary or secondary trauma. So direct or primary trauma means that the traumatic event is happening directly to you. You are in harm's way. So if a dog has attacked you, if a person is threatening you, if you've been in an accident or the victim of a crime or abuse, anything where the traumatic event is happening to you, that's a primary trauma. A big part of our work in animal sheltering is exposure to indirect or secondary traumatic stress. And that's when we are safe, but we are bearing witness to an animal or sometimes a person that is experiencing a direct trauma. So the person or the animal is traumatized, right? They're hurt, they're suffering, and we're witnessing it. And we can wind up feeling what they feel. We're like a sponge soaking it in. And the symptoms of direct or indirect traumatic stress can be exactly the same. Another thing many of us experience in our work is ongoing grief and loss through our jobs. We may be experiencing empathic strain, which I'll talk about in a moment. Lots of us have really challenging circumstances at home in our personal lives that are definitely making us more vulnerable to the stress and trauma that we experience at work. We may be experiencing ethical stress, and I'll define that later. And then our working conditions can contribute to our stress or our well-being. And at the end of the webinar, I'll talk a little bit more about that. So let's start with empathic strain, which is really another way of saying compassion fatigue. We are moving away from using that term compassion fatigue because it's not super accurate. We now know, just recently, neuroscience has shown that compassion and empathy light up two different parts of our brain. And so what is more accurate is that we are experiencing something more like empathy fatigue or empathic strain. So that's a long story. The difference between the two, the important part is just to recognize that you may see a shift in the terminology. The way we're going to define compassion fatigue today is that it is a profound physical, emotional, and spiritual depletion due to this constant demand of working in such an intense caregiving environment. And that depletion causes a decline in our desire, our energy, and our ability to feel caring or to behave in a caring way. So the definition, it's in the name, it's the fatigue of our empathy or compassion. And we don't get compassion fatigue because we are uncaring. We get compassion fatigue because at one point we cared very, very much. And we were giving everything we had, and we were unable to restore or replenish ourselves. So we're running on empty, we're fully depleted. And over time, that really erodes our ability to behave and feel empathy for others. So in animal sheltering and animal welfare, this often will play out in that we start to lose our empathy for other people first. So you might find that you're really critical or judgmental or short-tempered with your coworkers. For most of us, the first place we start to see it is with the public, right? So we start to lose a lot of empathy for the people that we serve. It may be hard to imagine this if you're new, but eventually a lot of us start to lose empathy for the animals. And what that looks like is just this kind of numbness. It's a disconnection. We just don't feel much of anything anymore. Again, because at one point we felt very, very much. And so the important thing to understand here is that this impacts our ability to do good quality work, but it's also with us all the time, including outside of the job. If we're experiencing compassion fatigue, it's a 24/7 experience. So we might find that we're having a hard time feeling compassionate towards our spouse, our partners, our own kids or pets. And even ourselves, we can be really unempathetic towards ourselves. So this is both a professional quality of life issue and a personal quality of life issue for us. If you are experiencing this now or in the future, I just want you to know it's not your fault. There's nothing wrong with you. It doesn't mean that you're not tough enough to do this work. The research is clear that this is a predictable, normal consequence of the stress that results from caring for and bearing witness to suffering and traumatized animals and people. So this is not specific to people who work with animals. Anyone who works in a helping profession, first responders, nurses, doctors, social workers, we can all experience compassion fatigue. And most of us over the course of our entire careers, we're likely to have at least one run-in with compassion fatigue to some degree. Even if we have great self-care practices, most people have some experience of this. For many of us, it tends to ebb and flow, throughout our whole careers based on different factors that I'll go over in a moment. But the important takeaway here is that too often we frame compassion fatigue as an individual shortcoming, and that is inaccurate. The research is clear. It is a hazard of our occupation. It's a predictable risk of caring for animals and people who are suffering and traumatized. So when we reframe it as an occupational hazard, there's less shame, blame, and we can more effectively address it, both individually and as an organization. So let's take a look at some of the signs and symptoms. This is your first red star. And this is really how we start to get a sense of, have I experienced compassion fatigue? What is it like for me? It's a very individualized experience. So we need to get to know our symptoms, because my symptoms and yours can be totally different, but we can both still be experiencing compassion fatigue. So it's that raising awareness of what it feels like for us. What makes something a symptom of compassion fatigue versus a symptom of being a very tired adult is typically the duration and intensity of the symptom. So it's normal to have insomnia for a few nights. If it's ongoing for weeks and really having an impact on your life, maybe it's a symptom of compassion fatigue. So you have a long list of symptoms in your workbook. Here are some of the greatest hits, some of the more common ones. Physical and or emotional exhaustion, and this is a profound exhaustion. Changes in your sleep, hypersomnia, sleeping all the time, or insomnia, not being able to sleep. One of my top 3 symptoms of compassion fatigue was interrupted sleep, which means I would fall asleep fine, but I would wake up at 3 in the morning, wide awake, anxious that I forgot to do something that day, like give a dog their medication, anxious that an adoption would get returned, or feeling very sad about a euthanasia or something that had happened that day. And I would be up for hours, and this would go on for weeks at a time. And so it absolutely impacted my ability to function during the day. Maybe you're struggling with a lot of sadness or guilt, a sense of helplessness or hopelessness, like nothing you're doing is making a difference. Lots and lots of us start leaning hard on substances to numb out those difficult emotions, to self-medicate. So we don't want to feel all that sadness or anger. So we're just going to shove it down with alcohol, drugs, food, gambling, online shopping, anything to numb ourselves out. We also might be using substances at the end of the day as a way to try to come down off of all of the adrenaline that is pumping through us as a way to get us through the day. So maybe we're using substances to try to kind of bring ourselves down. Anything is fine in moderation. I'm talking about, again, the duration and intensity where it could become problematic for us. Maybe you're noticing that you have a lot of intrusive images or thoughts, that are upsetting from work popping into your mind. A hallmark symptom of compassion fatigue is anger and irritation. So if your fuse has gotten really short with people or animals, maybe that's related to compassion fatigue. Cynicism, toxic negativity. So maybe, the cynicism shows up like there's new people on the job, they have so much enthusiasm and you're kind of crusty, like rolling your eyes at them, sure, been there, done that. Or we feel really cynical about the public. We don't trust anything that they say. That negativity can look like constant complaining and blaming. And I've been there, no judgment. Maybe you've noticed lately that you're kind of apathetic to work. So you're phoning it in, you're cutting corners. It's not your best work anymore. Many of us start to self-isolate and withdraw from other people. It's the end of the day, we're exhausted. We pull up in front of a screen, turn on a show, grab a beer, close the curtains, and we shut everybody out. Maybe you've just lost your life outside of work. And you used to have hobbies, interests, self-care practices, like all kinds of things beyond animals and work. And now it is just animals all the time. You may notice you've become hypersensitive, like overly emotional, having big, disproportionately emotional responses to things. So maybe a commercial or a movie used to make you a little weepy, but now you're like full on bawling, sobbing. And there's nothing wrong with emotions, but it just, maybe for you, it feels disproportionate. It's a big response. The opposite end of that spectrum is becoming desensitized. And that's the real hallmark symptom of compassion fatigue. It's this reduced ability to feel empathy and compassion. And this is typical for folks who have been on the job for a while. It's not typically the first thing that we experience. I think of it as like having the crusties, like we build a big wall between us and the work. And unless it is the worst case of animal cruelty we've ever seen, nothing really moves us anymore, right? So we become very numb, disconnected, right? We're just really checked out. And this is problematic because we need connection and empathy to do our work well. But also when we are this disconnected from the painful parts of the work, it also means we're disconnected from the joyful, satisfying parts of the work. We're not able to selectively numb out. So this is really hurtful for us personally as well. So that's like the hallmark symptom of it. It's why it's called compassion fatigue. There's another experience that you may or may not be having, and that's when we are exposed to a lot of secondary traumatic stress, we can eventually experience something called vicarious trauma. And that's a profound change in the way that we see the world because we're witnessing traumatic things through our work. So over time, again, this is not something that typically happens overnight. Over time, we start to notice that we see ourselves differently. We don't see the world as a safe place. Things that used to feel kind of neutral or safe now feel like dangerous, or something could be problematic. We're scanning for danger all the time. And we may have a very difficult time believing that other people can be good and trustworthy. And so I'm about to show you a quote that could have come out of my own mouth, and I've heard it from hundreds of animal shelter workers over the years. This is an example of vicarious trauma. I used to see the good in people, but because of what I've experienced at work, now I have a hard time trusting them, and I automatically jump to the worst conclusion. So bad things happen, and it starts to change the way we see the world, and that changes our behavior on the job. So, for me, this looked like I used to love doing adoptions, and then I did some adoptions that did not work out in the worst way, right? So animals were abused or neglected or died in the care of the adopters that I sent them home with. And so that completely changed my ability to see people as good and trustworthy, which translated into me having a very difficult time doing adoptions. At the time, I had no idea what vicarious trauma is or was. It's very important that we understand this concept, because most of us are shaped by this, what we're experiencing on the job. And it's not necessarily something that we can totally prevent, because we lose some of our innocence when we do this work. Once you're in animal sheltering, you are going to start to see things and learn things that you just did not know before you came into this line of work, right? So it's going to change you and change us. That being said, once we are aware of maybe how it's starting to impact us and how we're seeing the world differently because of what we now know, we can take steps to reduce its impact so we feel safer and we're able to do our jobs well and connect with other people. So one of the questions is, why does compassion fatigue come up throughout our careers? What are some of the factors that might contribute to us experiencing it? Something that's pretty common is if we're dealing with a cruelty case, or something where the animals are more traumatized than usual. Maybe there's been wildfires or a dogfighting case or hoarding or a puppy mill bust. Those animals are really traumatized, and we're bearing witness to their suffering. That can create the conditions for compassion fatigue. Workload, high volume periods, kitten season, but also the repetitiveness of what you do. So it's the same task, of animal care all throughout the day. It's the same conversations with the public, one after the other. It may be the first time that someone is surrendering their pet in their whole life. It may be the only time they ever relinquish a pet to a shelter. For you, it's the 10th time that you've had this conversation today. So you're just going through the motions. You are lacking empathy for the person because it's so repetitive for you. If we're not getting enough professional support or training, that absolutely, research says, makes us more vulnerable. If we're experiencing stress or trauma in our personal life. So if you're going through a divorce, if you have a sick kid, a sick pet, a sick parent, if you, lost your apartment and you have to move, all of those stressors at home make us much more susceptible to the stressors on the job. And then there's euthanasia, right? So we have the stress of performing euthanasia, but we also just all have, I think, a lot of cumulative grief. There's a lot of loss, one after the other building up, and we don't have a lot of time to process our emotions. One loss or one euthanasia piles up on top of another, or one upsetting interaction after another, not a lot of time in between to really, heal them or process them before the next. So let's talk a little bit about euthanasia. There's something called the killing caring paradox. And it's a paradox that the people who care the most about animals are also the ones who are tasked with ending their lives, with killing them, right? That is very specific to our work. No other helping professionals have to end the lives of their patients or clients. It's just very specific to us. What's important for you to know is that you do not have to be directly involved in the euthanasia process in order to experience compassion fatigue. You can work in programs, you can work with volunteers. It doesn't matter what you do, right? The work is what opens the doorway to compassion fatigue. That being said, if you are a euthanasia tech, or you are the one who is making the decisions about who gets euthanized, you are at higher risk for burnout, secondary traumatic stress, and ethical distress, which I'll talk about in a moment. And there's pretty new research just in the last couple of years that shows that the folks making the decisions, and this is true, like even when you have a very, very low euthanasia rate, where your live release rates in the 90s, euthanasia is not, happening in big numbers. You're still at very high risk, particularly if you're the one making that choice, because there's a lot of investment in the animals. So what's the ethical stress part of this? Ethical distress is when we know what the right thing to do is, but because of an external constraint, we can't do it. So whether that's a law, policy, local ordinance, organizational, practice, or lack of resources, we know what should be done, and we or the organization can't do it for whatever reason, and that causes the tension and distress. So right now in animal sheltering in 2022, what I'm hearing is a lot of ethical stress around, we know the quality of care we want to be giving the animals. This is from folks who've been on the job for a few years. Pre-pandemic, we were able to give them this quality of care, but because we are understaffed and overwhelmed, we're actually only able to do the basics right now. We can't maybe do all of the enrichment, behavior, walking that we need to do. We're only able to do the bare minimum of cleaning and feeding. And that doesn't feel good, right? We want to do this, but we can only do this. This looks like if you have to return animals to their owner, even though you think the owner, you suspect that they are neglectful or abusive, you don't have a legal leg to stand on to keep the pet. It's their property. You have to return it to them, right? Does that make sense? Is kind of where ethical stress might pop in. We know what the right thing is to do. We're not able to do it. We're euthanizing because maybe we don't have space or resources, and we know what we want to do, but we're not able to do it for whatever reason, right? So these are some examples. All of that ethical stress can absolutely contribute to compassion fatigue, but it definitely contributes to burnout. And the reason why, thank you, Bobby, the reason why it's helpful to understand ethical stress is that it's different than compassion fatigue. And for some of you, it may be the primary stressor for you, not so much compassion fatigue, it's ethical stress instead. So let's talk about burnout. Burnout is really intense, prolonged stress, high demands, without enough resources or support to cope with those demands. It's not just too much stress, right? It's not just being stressed out. It's stress without the resources to cope. And over the last few years, we have absolutely been struggling under like wear and tear stress of increased demands with reduced support and control because of the pandemic. So it's really creating the conditions for burnout. The trifecta of burnout symptoms are emotional exhaustion, professional powerlessness, this feeling of like nothing I do matters. I don't even know if I'm good at my job. Maybe I should quit, right? I don't even know what the point of this is. And negativity, right? So they're not that different than compassion fatigue symptoms, but they come from different things. Burnout stems from interactions with our working conditions, and it's not specific to your work in a helping role. Anyone who works a job can experience burnout. I always think of like Dilbert cartoons or The Office. It's like you can be a bus driver, you can sell sneakers. It does not matter. If you work and the conditions are right, you can experience burnout. So those conditions might be long hours, endless meetings, low pay, toxic coworkers, being in a role that doesn't match your interests, strengths, skills, values. When any of those conditions are present and the demands are high and the resources to cope are low, we might experience burnout. Compassion fatigue stems from our interactions with the animals and people we're caring for, that empathetic relationship that we're in with them. So it's much more specific to helping roles. The way that we remedy the two is also different. We remedy burnout by changing our relationship to the working conditions, or we change the working conditions if we have that power. So maybe we start taking our paid time off again. We ask to be transferred to a different team or to take on a new project that feels like a better fit for us. Maybe we go to a different organization. Whatever it is, we change the working conditions, burnout will likely resolve itself. Compassion fatigue, on the other hand, will follow you anywhere you go where you continue to work in a caregiving role. So even if you get paid $1 million, you have the best coworkers, you only work 2 days a week, if you continue to work with animals and people who are suffering and or traumatized, then compassion fatigue remains an occupational hazard because it's tied to the nature of the work that you're doing. In animal sheltering, many of us are experiencing both. COVID has absolutely exacerbated the conditions for burnout. And so everything that I'm going to talk about today really does help with both. So here's your first practice that I really encourage you to just start playing around with, explore it. Figure out what your top symptoms of compassion fatigue are, your most common ones, or maybe your top symptoms of stress, and then I want you to chart them out on a continuum using the workbook exercise. We have on the far end of the continuum, we have the green zone. That's when our symptom is like pretty much non-existent because we're doing great. And then on the far other end is the red zone, where that symptom is so bad that we're pretty much in crisis and we cannot ignore it anymore. It's really making it impossible for us to function well. We're generally aware of like doing well, green zone, and really not okay, red zone. What we're not good at is noticing the more subtle differences along the continuum from yellow into orange. And that's the really rich part that we need to be tuning into, because those changes in our symptoms, that's where we have the ability, if we notice those changes in real time, we can take steps to intervene for ourselves before we get into that red zone. Too often, we're so consumed with the animals and all of the fires that we need to put out that we do not pay attention to our own needs until we are forced to, because we're in crisis in the red zone. So a fundamental part of being well in this work is to know, to stay aware, that A of the ABCs of yourself as your symptoms fluctuate and change. I encourage you just to check in with yourself once a week. Take 15 minutes to chart your symptoms out. That's the hard work. And then going forward once a week, take 2 minutes. Where am I at? Are my symptoms getting better or worse? If you're not sure of your stress or compassion fatigue symptoms, no problem. Just check in once a week to see how your basic like well-being behaviors are changing. Am I sleeping more or less this week? Eating differently? Moving more or less? Am I withdrawing or staying connected to the people I care about? The idea here is on a week-to-week basis, we want to know, am I moving towards the green zone or am I moving towards the red zone, towards wellness or worseness, right? I really encourage you to buddy up with someone at work, where you just make an agreement that you will check in with each other once a week. Where are you at? Where are you headed? You know, what can you do to help yourself, or what can I do to support you? The other thing we can do is to take the professional quality of life assessment quarterly or seasonally. And this measures burnout, compassion, satisfaction, and secondary traumatic stress levels. And this is important because truthfully, when we have compassion fatigue, we do not do a great job of accurately assessing ourselves. We can't see ourselves clearly sometimes. So this is a subjective or an objective tool that we can use that's external to us to just take our temperature. Where am I headed season to season? I encourage those of you who run meetings, if you are in charge of the agenda for a meeting, to put a quarterly reminder in, to print out a bunch of these evaluations for your team and to give them 15 minutes on the clock to take it. Their results are private, but it will give them some time embedded into their workday to check in. So you may find that when you're checking in with yourself, you are in the red zone and you're headed there, and you may start to ask yourself like, well, when do I need professional mental health help? So here's some general guidelines. Compassion fatigue generally responds well to self-care and support. So if you're doing more of that and things aren't getting better or they are getting worse, then we may need to talk to a doctor or a therapist. But if you're feeling hopeless or you're having even passing thoughts of suicide, we definitely want to reach out to a pro. Same thing if you're struggling with clinical depression, anxiety disorders, or PTSD, post-traumatic stress disorder. And PTSD, the trauma, can be direct or indirect trauma. So both of those things. I just want to talk a little bit about traumatic stress for a second. If you experience something traumatic on the job, let's say you witness an animal that has been badly neglected or abused, and you go home that night, and as you're trying to fall asleep, you have a flash of their body, or you start to have nightmares. If that happens for a few days, that's actually a normal response to an abnormal event. It's normal for you to have some traumatic stress after a traumatic event. When we're talking about PTSD, we're really talking about it being ongoing. So it's weeks, it's a chronic response. And that's when we definitely need to go get help, right? But it is a normal response to have some of these experiences for a short time. And then most of us rebound from that, right? With some self-care, with support. The other thing to consider is really, please do not wait until things are chronic or really bad for you to reach out. It's okay to get into a relationship with a therapist when you are doing okay and you want help staying that way. If anyone has experienced any of this mental health stuff, you know it's really hard to call around or email and find a therapist when you're dealing with clinical depression, right? I've had depression. Just feels impossible to pick up the phone and call around and find someone who takes my insurance and to interview them and to see if I like them. The only time I have energy to do that is when I'm okay. So a really beautiful, proactive thing that you can do for your future self is to do the legwork of getting into a relationship with a counselor that you like now when you're okay, and they'll be in your corner when things inevitably get hard. So another thing, if you are in a leadership role or HR, that you can do to support your staff is do some of that legwork for them. Let's get a referral list going. Who takes your insurance and is currently taking new clients that maybe also specializes in trauma? What are the resources in your community for grief and loss support or trauma support? And then making sure that you update that list and you're just taking a barrier down for your staff, right? They know that you've got this resource for them. So that's some of the really hard stuff, the way that the work depletes us, but the work also really fills us up and gives so much to us. And that's best understood as compassion satisfaction, which is the tremendous pleasure that we get from doing our work well when we're trained and we're competent, we know what we're doing, and we know that our efforts are making a difference and we're having an impact. And when we have high levels of satisfaction, we're more effective. It reduces our compassion fatigue levels, and it helps to sustain us in our work. So before I get into what we can do about all of this, reducing fatigue and burnout and building compassion satisfaction, do you all have any questions about what I just went over? Signs, symptoms, definitions, with the promise that we're going to get into what we can do about it in a second. My dog is snoring really loud. Where does decision?
Jessica, it's Bobby. I have a question.
Okay. Yes, go ahead. And then Jess, I'll grab your question. Go ahead, Bobby.
Is it normal or part of PTSD if you have a reaction to a case and it brings back something from a previous case many years prior that is similar? I mean, is that a normal reaction?
I think it's both normal and it can be connected to the trauma that we've experienced in the past that may still need healing. So part of trauma is that it's stored in our bodies. So we might, smell something or hear something. It doesn't have to be a logical or rational thought. So something that we see or smell or feel with a current case or experience can trigger old traumatic memories, because the smell is connecting us or the sound is connecting us. And so it's both common and normal. And if it is having a negative impact on you, it may be an indicator that we just have some old trauma that needs some healing. And that's when it's really helpful to work with a practitioner that specializes in trauma and that often goes beyond talk therapy and can move into body-based therapy. And that's a whole, there's many, many different modalities that work with trauma in the body. That's I think the shortest answer I can give, but I could also send some resources after today that goes deeper into that if that's of interest. But does that kind of answer your question? Okay. It's complicated. It's simple and complicated at the same time. It's a great question. So Jess, let me grab your question in the chat. So I saw, where does decision fatigue fall as a symptom of compassion fatigue? For example, I and my team may make outcome flow decisions regularly, including euthanasia decisions. And sometimes if I have a particularly decision heavy day, I will have trouble in the evening making any additional decisions, even as simple as what to eat for dinner. Is this a symptom of compassion fatigue? So that kind of mental fatigue can be a part of our experience of compassion fatigue, but decision fatigue stands on its own, meaning you can have decision fatigue and not have compassion fatigue. You might have both at the same time. So that kind of mental exhaustion, one symptom of compassion fatigue can be really not trusting your decisions anymore. So maybe you used to feel really confident in your ability to make that euthanasia decision. And now you're like questioning yourself every time, or you're in, the veterinary medical care, and you used to feel really confident about deciding the medical or behavioral treatment. And now you just feel like you can't trust yourself at all, right? So it's like a mental fatigue around making decisions. And that can absolutely be a symptom of compassion fatigue. It can also just be plain old decision fatigue. And so, one of the kindest things that we can do for ourselves is make those, hardest decisions early in the day when we still have, some fuel to do it, and to ritualize or make routines out of everything in our lives that we can. So like eating the same thing for dinner, right? Like every Monday, it's taco night. Every Tuesday, it's leftover tacos. Every Wednesday, it's pasta. So can we take any decisions off the table, leaving the mental capacity for the decisions we have to make day to day? Does that make any sense? It's a big part of our experience. It's yet another factor that plays into our stress and distress levels. Yeah, you're in really, really, really good company, right? So yeah, make anything that you can simple in your life. Truly, I've eaten the same thing for breakfast for years. Just I always wear the same black t-shirt for every webinar. Like that is in part to reduce decision fatigue for myself. Okay, now you know why I wear this t-shirt. Okay, so what do we do about it? Thank you for those 2 questions. Those were really thoughtful questions. I appreciate it. So this is what we can start to do about it. The research shows that there are these 5 ways that we can promote recovery from adversity and stress, and they tap into these 5 essential human needs that we all have. And if we can address any of them, doesn't have to be all of them, that's great if you can, but any of these can start to help us reduce the harmful impacts of stress and move us towards that green zone of well-being. So the first essential human need is we all need a sense of safety, physical and psychological. The second is we all need the ability to calm ourselves, and that's about calming our stress response. Third is social support, and research is showing that social support may be more important than self-care when it comes to stress. 4 is we all need to have a sense of self-efficacy and collective efficacy, meaning I as an individual and we as a group have what it takes to cope with this challenge, with this difficult emotion, with whatever this is. We've got what it takes. We are competent to handle this. And 5 is a sense of hope, confidence, faith that things are going to be okay in the future, even if they are not okay right now. These are things that all human beings need. It may look different for each of us, but we all need them. And we're going to start with number 2, the ability to calm ourselves, because it is a foundational skill for all the other ones. So this is about calming actions. How do I feel in the moment in terms of our stress response? So here's a question for you. If you feel like answering it in the chat or yelling it out, how many times a day do you think the average person's stress response gets triggered? This is the average person in an average job, non-pandemic. Do you think it happens 50 times a day, 12 times a day, or 39 times a day? So we've got a 39, a couple 12s, another 39. Those of you in groups are welcome to unmute and yell if you want. Another 39. All right, any more guesses? It's 50, it's A. Yeah, Valerie got it in under the buzzer. Yeah, it's 50 times a day. That's for the average person. It's not for a helping professional. It's not for somebody who works in a trauma-exposed job during a pandemic. And so let's assume that you are sleeping a few hours a night. This means your stress response gets activated multiple times an hour that you are awake. And this really contributes to this cumulative load of stress that lots of us are struggling under right now. Chronic stress and or traumatic stress will start to impact and change our brains and our nervous system, which makes us more sensitized to stress. When we become sensitized to stress, we're less resilient to it. We have less of an ability to cope effectively with stressors, and it takes a lot less to stress us out. So something very minor, right, can really push us over the edge. Is anybody experiencing this right now? I am, for sure. 2022 is like the year of cumulative stress for me. And the important part here is to just start to recognize Are you struggling to, maybe cope with stressors or demands that a couple of years ago you were able to deal with? And if so, it may be due to this cumulative load. A lot of us are kind of thinking of 2022 as like post-pandemic, which everyone I know has COVID right now, so it doesn't feel post anything. But I think we have a perspective that like things are easier now, less stressful in 2022 than they were in 2020 when it was so acute and we were like trying to empty the shelters overnight. And that was so intense. And so we thought, oh, well, that was really stressful. It's much better now. My theory is that actually we were in much better shape in 2020 than we are right now. It may be less acute in 2022, but this cumulative load of having our stress response chronically activated for 2.5 years has had a real impact on our mental and physical health. So many of us are far less stress resilient in 2022 than we were 2 years ago. So if that is you, then you are in good company. Let's talk about our nervous system, because this is what starts to change under chronic stress. Our autonomic nervous system controls our stress response. And when it perceives a threat, it triggers the sympathetic branch. It pushes us into fight or flight. This is like the gas pedal on stress. And it triggers our survival mode. It helps us to survive the threat. It's automatic, knee-jerk, very fast to keep us alive. And there's not a lot we can do about stopping our sympathetic from getting triggered. It's really fast. It's not rational. It's there really to help us survive. So maybe we can't stop our stress response from being triggered 50 times a day, but once we're aware of it, we can take steps to consciously engage the parasympathetic, which is the brakes on our stress response. It moves us into rest and digest, repair, and connect. And that's what we really need in order to recover from stress. We've got to get into parasympathetic recovery. And most of us aren't. We're stuck in sympathetic survival mode. And the reason why is because it's not just real threats to our survival that trigger our stress response, it's perceived threats. Both set off the same physiological response of adrenaline and cortisol, pumping through our bodies to help us survive. Whether the threat is real, there's a bear chasing you, or it's a perceived threat. You perceive to hear a bear in the woods somewhere in the distance, or you're thinking about a time 10 years ago where you got chased by a bear, or you're watching a movie on TV and someone is getting chased by a bear and your heart is pounding and your hands are gripped while you're watching this happen. Same physiological changes, whether or not there's a real threat to your survival. If your nervous system perceives it as threatening, we're going to get into fight or flight. And so for a lot of us, this looks like trigger stacking all day at work because painful feelings can trigger our stress response. When we have a lot of empathy for animals and people who are suffering and traumatized, it feels painful in our bodies, right? It's not just a mental experience, it's in our bodies. And that painful feeling, our nervous system perceives that as a threat. And so our stress response gets activated. If we're having worried thoughts about how much we have to do and we can't get it done, or we're worried that we can't pay rent, we're worried about what's happening to the animals, that can trigger our stress response. And all of these challenging social interactions that you are having with coworkers and members of the public who are also chronically activated, they are also in fight or flight, right? That triggers your stress response, as do just challenging tasks, particularly like when we're not trained yet and we're new. That lack of competence can be really stressful. And so most of us are struggling with this like chronic activation of our stress response, which really feels like overwhelm, exhaustion, and we're not able to get into parasympathetic recovery so our brains and our minds and our hearts can heal and rest and recover. And so let's talk a little bit about what happens to your brain when you are in the stress response. It's the difference between having a reactive and a responsive brain. Dr. Dan Siegel has something called the hand model of the brain that I found really helpful. And so I'll use it here. My wrist is the brain stem. This is like automatic functions that keep you alive. Reptile brain, dinosaur brain, it's the oldest part. The middle part is the limbic system. This controls our emotions and memories. This is where our amygdala lives. The amygdala is like the fire alarm, threat sensitive. And the top part where my knuckles are, the yellow part on the screen, this is our prefrontal cortex. This is a part of our brain that we absolutely need online in order to do our jobs well. Our prefrontal cortex, which doesn't stop developing until we're in our early to mid 20s, right? So it's the last part of our brain to fully develop. This is what we need in order to communicate effectively, problem solve, access empathy, be curious, flexible, learn, and connect with others. Literally everything we need to do our jobs well, we need our prefrontal cortex working with these other three parts of our body. But as Dr. Siegel likes to say, when we go into fight or flight, we flip our lid and we are being driven by the downstairs part of our brain. This part of our brain is only concerned with surviving a threat. So our thinking gets very black and white. We get very rigid, right? People are good or bad. There's no in between. So we start blaming other people, shaming, judging. We can't learn. And often we behave in ways that we regret, that it's out of our integrity. So it becomes part of our, skill set to learn, what does it look like when I'm about to flip my lid? What does it look like when I have flipped my lid? And how do I make sure I bring it back online so I can best handle this difficult situation or make repairs if, I have flipped my lid and I have some cleaning up that I need to do. So how do we do it? We do it through this critical skill of self-regulation. If you learn one thing today, it's this. We all need to be able to self-regulate, which is intentionally pumping the brakes, engaging the parasympathetic. That's the calming action that all humans need to know how to do. This is moving ourselves from knee-jerk reactivity to a more calmer, intentional, responsive way of interacting when there is a perceived threat. If there is a real threat to your survival, you let your fight or flight kick in to protect you. So again, I'm talking about worried thoughts, emotions, challenging, difficult, upsetting parts of your job where you are technically safe. When we practice calming actions, it helps to interrupt that pain of the empathy that we feel that's causing pain, helps us to be more emotionally regulated, to think and communicate clearly, to be a steady, non-anxious presence for the animals and people that we're surrounding ourselves with all day. And after the stressful event, it helps us to turn off that chronically activated stress response so we can move into parasympathetic recovery and rest and heal. So Jess said you suffered a pretty traumatic experience at work and have received great support, but the compassion fatigue is there for sure. But how long should it take for compassion fatigue to fade? Furthermore, if you start to have or see or recognize CF symptoms for weeks, months, at what point should we start searching for other outlets or additional help? I would say there's just no reason to wait. Like, you don't have to suffer. There's no litmus. Like, you don't have to reach a bar of suffering in order to give yourself permission to reach out for help, right? If you've had a traumatic experience at work or anywhere, most of us need help from others and a variety of help in order to heal that. So it may be that we've been getting one kind of support and it's helped us to a degree, and then we have to layer on other modalities or other approaches to our healing to really help solidify it, particularly because we continue to be exposed to trauma every day or most days on the job. So it's not just in the past, right? It's also being, I think this is kind of what Bobby was speaking to, like it's also being activated and there's a cumulative kind of effect. It's not just in the past, it's constant exposure. So we all need like a lot in our corners to stay healthy and to continuously heal and process what we're experiencing. Does that kind of answer your question? Yeah, you're welcome. And I'm sorry that you experienced it, and you deserve all the help in the world. We all do. Like, let's not wait a minute. Life is really, really hard, period. It's even harder when we do this work. So like, no need to suffer anymore. Okay, so here's a question. If we're going to start to self-regulate, when do we do it? A clue is when we notice that our fight or flight response has been triggered. Usually we have many changes in our body because it's happening in our body quicker than our mind can even know that we're in the stress response. We're having many physiological changes when our stress response gets activated, but there's typically one or two changes that are very obvious to you right away. So for example, you may notice that your hands are shaking, your heart is racing, cheeks are flushed, stomach flip-flop, vision change, all these things might be happening, but one or two of those things is like real obvious right away. If anyone feels like sharing in the chat, I think it can be helpful to kind of see what other people experience. It reminds us of like, oh yeah, I have that too. So for me, if there's a perceived threat, and that perceived threat is often social, Like I think that someone is upset with me. I get an email where someone is maybe criticizing me, or I think I've made a mistake. I will notice that my hands start shaking immediately, right? Other things change, but my hands are the clue, and then my heart is racing. And that is my signal that my stress response is getting activated, and I need to cool out and self-regulate before I respond to that email and maybe make things worse. The other thing that we want to look for in terms of a cue of when to self-regulate is when our behavior starts to change. So when we go into the stress response, we tend to either move faster, talk louder, snap out at people, or we get small. We lose our words. We can't make eye contact. Everything slows down. Maybe we start crying. Maybe you start hustling, like you try to take on more and more and more work. So I don't know if anybody knows what their go-to behaviors are. Mine tends to be, if I'm moving very, very fast and I'm irritated with people, I know that I've moved into that very reactive, stressed out zone, and I'm probably going to cause some damage that I'm going to have to clean up later. The sense of dread. Yeah. Do you know where you feel that in your body? Or is it more like it changes the way that you behave? You don't have to answer. These are things to start to get to know about yourself, because these are very clear cues that from your body and sometimes your behavior that now you have to self-regulate. And that looks like stopping, right? Stress usually makes you kind of go faster. You're trying to outrun the stress or the work, the challenge. Counterintuitively, we need to stop talking, stop moving, stop trying to handle the animal, just pause and disengage from whatever is triggering our stress response, even if it's only for 30 seconds. So you're having a really difficult conversation about euthanasia. Everybody's exhausted. It's starting to get snarky. Everybody walks out for a second, right? Before you storm out, you make the choice to pause and go to the bathroom and take a few deep breaths or have a glass of water. If you have someone at the front desk, a member of the public, they have flipped their lid, it's really stressing you out, you excuse yourself to go grab some paperwork from the back room or to check with your manager. If you're an ACO out in the field and someone's in your face, you go back to your truck and because you have to call it in or get some equipment. These are like small white lies that are designed to buy you a little bit of time so that you can calm down, make sure your prefrontal cortex is engaged so you can go back to that upset person or difficult situation or animal with a more calm, steady approach. This alone can literally change your life because you just won't have to clean up so much drama after. But sometimes it's not enough, or we can't disengage. And that's where our breath really comes in handy, because our breath is what most directly can engage our parasympathetic, the brakes. And the simplest thing to remember is just try to extend your exhalation a few beats longer than your inhalation. Your exhalation slows your heart rate down. So like if you're in front of someone, you can just kind of like real casually start to like breathe out a little bit longer, slowing it down. Often like a 3-6 balance, breathe in for 3, out for 6. If you can get away from whatever the stressor is and you can really blow it out, that's great. There's something called resistance breathing, which can be helpful, particularly those of you that focusing on your breath makes you more anxious. Pursed lip breathing can be a little more helpful. And it just looks like breathing through a straw, like or breathing out, blowing bubbles. You can really do yourself and the animals a favor by grabbing some catnip or bacon bubbles and doing a little bit of enrichment. And, by blowing those bubbles, that you're engaging the brakes, the parasympathetic. So we can just be doing this as we move through our day with the assumption that our stress response is activated. Let's just keep taking those deep, deep breaths to slow ourselves down. But it's particularly helpful when we can't disengage from the trigger. Sometimes that's enough. Sometimes it's not. If you're really overwhelmed emotionally or whatever it might be, one of the most helpful things we can do is to ground ourselves in the present moment using our senses. So that looks like looking around the room you're in and labeling all the red things that you can see, or just saying out loud or in your head 40, 50 things you can see in the room. So it's simple. It's just workbook, fan, pit bull, couch, flip-flops, phone. That's it. And what you're doing is you're using language, and that is sending blood back up to your prefrontal cortex, bringing it back online. But you are also telling your body, your nervous system, I am safe here in this moment. If that's true, if you're in danger, that's different. But most of the time, we are lost in upsetting thoughts about something that happened in the past, or we are anxious about something that might happen in the future. And even if we are upset or dealing with a difficulty, technically we are safe in the present moment. And this is a way to tell your body, this may be challenging, I may be upset, but I am safe, because look all around the room, we're okay. I find this most helpful when I'm going to start crying and it's not a great time to cry. This is very effective for me, so maybe it will be for you. So one of the examples, that you may use this is if you're doing a euthanasia with an animal that you feel very attached to and you're starting to cry, right? You feel emotionally dysregulated. Maybe you and your partner, you could go back and forth and just start saying out loud everything that you see in the room. It really can be very, very helpful, and you're collecting yourself, right? The animal needs you to be a steady, non-anxious presence while they transition. So you're getting yourself grounded and calm so you can be that for them. And then after the euthanasia, you can let yourself have the big cry, right? And move it out. But in the moment, you really help ground yourself. The other thing you can do is just literally shake it out, exactly like the animals do. We tend to tremble or shake, because of our stress response. If you're naturally shaking, just let your body tremble or shake to conclusion. Let your stress response finish. Right? Instead of stopping the shaking, let it happen. Or you just can purposely really shake it out, Muppet arms, the way that the animals shake off stressful things. And this is a really helpful way to reset, get yourself back in the present moment, out of those thoughts. We can also soothe our nervous system with, specific calming touch. This is, I think, very helpful when, we're having painful emotions. So if you want to give it a try, one of my favorite ways to do it is just to place your hands over your heart, just like the photo, just a little bit of pressure. And every time I do this, I have an involuntary sigh. You might have it too. And the reason that happens is because when you're pressing here, you're pressing on your vagus nerve, and the vagus nerve activates the parasympathetic branch, the brakes. So this is why, if you have ever noticed, it feels really good to have like a cat or a bunny lie on your chest or your stomach. That weight is pressing on your vagus nerve, and it's helping to calm you down. When I can't sleep at night, it's like my cat's job to get on there and put some pressure on my vagus nerve. It's also why, weighted blankets can be helpful. These things are different for each of us. We're all different. We're all changing all the time. So we need to experiment with what helps to calm our body down. So the practice I am suggesting is for you to repeatedly throughout the day pause to pump the brakes on your very overactive stress response. I know you don't have a lot of time, so I'm not talking about long breaks. This is 30 seconds of hands over your heart, or a minute of, going outside and getting some distance from the difficult conversation, 5 deep breaths every time you go to the bathroom. Stress is cumulative, but so is stress management, self-regulation. And if we tap on the brakes all throughout the day, it helps to get us back under threshold so we can be emotionally calm. We're not getting into so much drama and conflict, and we just feel better at the end of the day. I know these things feel very simple, maybe too simple to address the really complex stress that you're dealing with, but we are animals too. And often we need to calm our animal body before we can access our logical, rational brain. If you have ever told yourself or someone else to calm down when their lid is flipped, it doesn't work because their prefrontal cortex isn't available in that moment. So if we can calm our body first, it allows that rational brain to come back online. That's all well and good. And we also need to practice self-care. Like, what do we need overall to be well? I really encourage you just to invest in doing more of the basic biological self-care practices that you are already doing. You don't have to do anything fancy. Just double down on making sure you're hydrated, that your blood sugar is steady, that you're sweating out some of that cortisol and adrenaline, and please get more sleep. And if we do these things, you would be shocked at maybe how far that can take you. Because when our biological needs are met, everything gets easier, both emotionally and mentally. Everything is working better when our body's biological needs are met. When they are not, it pushes us back into that sympathetic survival mode. When we don't get enough sleep, we might notice that our thoughts are really anxious the next day, or we have a really hard time managing our emotions, right? It's really, it's wonderful if we can do some of those higher level interventions, working with our thoughts and our emotions, and I'll talk about that more in a minute. But fundamentally, if we only do one thing, if we care for our body's basic needs, it will make all of that other stuff, the emotional and cognitive stuff, so much easier to do. So I really, really encourage you just to double down there. And to do that, you have to be honest about maybe where your needs are not getting met. So just over the last few weeks, because it changes month to month, what do you know that you need more of right now? Do you need more sleep? Do you need to be eating, better food? Like when I was at the shelter, I kind of survived on donuts and coffee, and that was problematic for lots of reasons. So maybe you need more nutritious food or movement because you're desk bound all day, or you're dehydrated, you're wearing PPE all the time, or maybe it's all of the above. For me, I know that, over the last few weeks, it's been sleep because my dog has been sick and it's really impacted my ability to sleep. But as things have leveled out there, now I'm noticing I'm not moving enough, right? So I'm kind of stewing in all of this adrenaline and cortisol that has been pumping through my body. So really think about what you need more of. But in order to do any of these things for ourselves, we need a cushion of time and energy for ourselves. And that's where healthy boundaries come into play. And healthy boundaries start with a mindset shift. This is not a sprint where we can postpone our self-care until the work is done, because it's never going to be done. We're in a marathon without a finish line. So we have to figure out how we're going to pace ourselves if we want to stay in the race for the long haul. Pacing looks like taking our breaks, even though our work isn't done and there's more to be done. It's turning off devices so we can get out of the stress response and relax. It's maybe taking a break from bringing animals home all the time, so when we're home, we can really be home and off the clock. It's reminding yourself that you will be able to do better quality work when you meet your own needs. So it's not selfish to take care of yourself. And in addition to the mindset and the pacing, we need our organizations to provide guardrails. Healthy boundaries are a collective effort through policies, adequate staffing, realistic workloads, and a culture that really celebrates a sustainable approach to this work, celebrating people who take their paid time off, right? Instead of celebrating people who push through and work 60 days straight. All of this is with the understanding that helping is not sustainable without boundaries. We can all do the sprint. We can all be the hero for a little while, but it will catch up with all of us and push us out of the game. So our empathy really requires that we set healthy boundaries so we can do this for a long time. In order to set healthy boundaries, we have to understand that sometimes it's going to be really painful. When we set a boundary to take care of our own needs, it often means that we're not going to be able to do something for the animals, and that hurts. So then we don't do it. But what I want you to know is that healthy boundaries that will take care of your well-being and over time allow you to help way more animals, right? Healthy boundaries can be the right thing for you to do and still feel pretty terrible in the moment. Both of those things can happen at the same time. And so when we are struggling to feel okay about setting boundaries and taking care of ourselves when animals are still suffering, that's when self-compassion comes into play. It's acknowledging this is hard, I am suffering, but I'm not alone. And how can I be a good friend to myself? How can I treat myself the way I would treat a friend or an animal if they were suffering? And this takes us into emotions, because self-compassion in action looks like asking yourself, what do I need right now? And we figure out what we need by figuring out what we're feeling. The function of our feelings is to tell us what we need. So what am I feeling? What does that tell me that I need? And how can I meet that need even a tiny bit? On the clock, that's going to look like coping for the most part, where we practice things like calming actions to help kind of cool out and calm the anger or the sadness, that emotional reactivity. Maybe it's getting some support. Afterwards, we're looking at healing, really processing, allowing those big feelings to come up, right? Maybe we had to stay cool and compassionately detached all day. At some point, we have to feel all the feelings. So what allows you to safely feel those feelings so you can process them and release them, so you're not carrying so much around? It's different for each of us. For you, it might be prayer, meditation, therapy, going to AA meetings, talking to a pastor or a rabbi or a good friend, expressive or creative art forms, being in nature, writing in a journal. We all need a place to safely feel those feelings and let them go. And the other thing in terms of supporting our emotions is we need to be able to assess, are some of these emotions accurate? What I mean is a lot of us are struggling with guilt, a huge amount of guilt, and we feel guilt over things that actually were totally out of our control. And so a really important skill for us all to learn and practice all the time is zone of control thinking. This is when we understand in any situation, past or present, what is within my control and what is not. What is within your control is you, and that's about it. It's how you show up for the work. It's the process of how, the effort that you put in, how you relate to other people, how you care for yourself. We have the ability to influence the animals and people around us, but ultimately we do not have direct control over how other people feel or behave or think. We can't make anyone do any of those things. And we don't have direct control over the outcome of our efforts. So what I mean by that is you can do the best adoption counseling ever, and still the adopter lied and they abuse or neglect the animal. Or you can do the best adoption counseling and the animal gets returned. You can do the best medical care and still the animal dies during surgery. The best behavior modification and still the dog bites someone and needs to be euthanized. You can put together the most airtight cruelty case and still you lose in court and the animals need to get returned. Right? The outcome is beyond our control because we as an individual are just not that powerful. There's too many other factors at play. There's other human beings and animals and environmental factors and genetics and luck and the weather. There's a million things that are happening every day that ultimately contribute to the outcome, right? And so we need to be aware that the part that we have control over is the effort, the process of what we do, and the outcome we need to hold a little bit more loosely because it's not in our full control. And this takes me to our fourth practice, which is thinking about the way that we think and being very intentional about our thoughts. So as you go through your day, just experiment with noticing what do you tend to focus on? What's the background conversation that you're always having in your mind? How we think and perceive the events that are happening around us and to us at work, that is what determines how we feel and behave. And what we know is that our thoughts can trigger our stress response. They can lead to painful feelings and ultimately drain our resilience because we stay so activated, we can't rest or heal. Or our thoughts can help to calm us, to help us stay motivated and sustain our resilience. So as you go through the day, just notice, are my thoughts helping me or hurting me? Are they draining me or sustaining me? If your thoughts and perceptions are draining you, you may just want to start asking yourself, what else might be possible here? One way to remember to do that is to practice an old improv rule, which is always say yes and. So yes, I'm upset that this is happening. Yes, I think this person is terrible in whatever way. And it's possible that I don't know the whole story. It's possible they're doing the best that they can. It's possible that I'm not interpreting this correctly at all because I don't know everything. Yes, I'm really upset by this, and this is what I'm going to do to cope. Yes, this terrible thing happened, and here's something good that also happened today. The idea here, again, is to practice really noticing what's within your control. You may not be responsible for whatever's happening, what the other person is doing or the upsetting thing that's occurred, but we always have a responsibility to wisely choose the way that we respond to things that are upsetting. And so we can use that zone of control to figure out how do we want to respond. If whatever elements are within your control, then you can focus on, okay, so what's the best action that I can take in this situation? Whatever's out of your control, fine, what can I do to cope with it? What am I feeling? What do I need? What actions do I need to take to cope with it? All of this plays into a mindset that resilient people tend to have, which is realistic optimism. So that's the learned skill of focusing on the positive without denying the negative. Yes, this was really terrible. And also here's something good that happened. And channeling our extremely limited energy towards what is within our control. One of the good things that we need to pay more attention to is the rewarding and satisfying parts of our job. So why do you choose to do it? It's really hard work. Why do you keep showing up? What do you find joyful, satisfying, meaningful about your day? Just start paying attention as you go through your day. What are the tasks and interactions that like feel really good? Are you aware of those good moments when they are happening, or are you so lost in replaying an upsetting conversation from the past? I wish I said this, or worried about what's going to happen in the future and the to-do list that you miss out on the actual good parts of your job. The work depletes us, it drains us, and the work can fill us up and give to us, but only if we notice it. Only if we are there present to savor the good can we reap the benefits of the good. So on those really tough days, when the outcomes are not good, when it's hard to be aware of the positive parts of our job, it can start to feel like nothing we're doing makes a difference. And what I want you to remember is always to try to widen your perspective. When we're stressed, our perspective literally and metaphorically gets very, very narrow. We're only focused on the negative. We need to widen our perspective and see the big picture, which is over the course of your career, each one of you is going to or already has helped hundreds, if not thousands of animals. Even on the worst days where everything went wrong, the animals are still better off because you showed up. You absolutely matter. And even if you can't do things the perfect way that you wish that you could, right? You are doing the best that you can with the limited resources that you have, and that is enough. That's all we can do, is to show up and do the best we can with what we've got. So one of the ways that we can start to kind of rebuild the positive part of our perspective, right, when it gets very negative and narrow, is to try something called 3 good things, or what went well. And all it is at the end of the day, maybe right before you go to bed, write down 3 things that went well that day at work or in your personal life, and what your role was in making those good things happen. The research shows that if you do this for 2 weeks or more, it has positive effects on your mental health. And in nurses, this has been shown to reduce burnout and increase compassion satisfaction levels. Anecdotally, I can also tell you it helps a lot of people to fall asleep, because instead of worrying, which activates your stress response and wakes you up, this can help, calm you down and you're in a good place, and it helps you to relax and fall asleep. So do this on your own, or maybe you do this together as a team, at the start of a meeting, before you get into all the problems that need to be solved. What are some things that went well this past week? How did we make that happen? Remember that being able to see the impact that we're having, that's a big part of compassion satisfaction. And this leads me to the last practice, which is we really need to stay connected and give and receive support. I can't stress this enough. You matter so much to each other. The research is pretty clear that social support at work, having caring, collaborative coworkers, and a direct supervisor that you believe cares about you, that's the most significant factor associated with high levels of compassion satisfaction. The higher your compassion satisfaction levels are, the lower your fatigue levels tend to be. And our higher levels of satisfaction are dependent on our relationships with each other. So we really have a big impact on each other's well-being. We also know from decades of research in general that all human beings really benefit from social support. It's a very powerful way to buffer against stress, and it also helps us to heal from past adversity and stress. Having caring, safe relationships really helps us to heal. But we're stressed out, and our stress, our emotions, our perspective, they're highly contagious. Right? Just as contagious as COVID. And so we know this, right? Like when we're around someone that's in a bad mood, even if they're not saying anything, we just feel their energy. The animals feel our energy, right? If we're really stressed out or negative, right? We all understand this, I think, because we have to be mindful of this with animals. So we just want to notice this with each other. What am I spreading when I come into the room? Am I a source of drama, conflict, stress, reactivity? Am I amping everybody up? Or am I a source of connection, support, safety, realistic optimism for the people around me? And it doesn't just help them, it comes right back to you. Our well-being is interdependent, right? We need to take care of ourselves, and that ripples out to everyone around us and comes back to us. And this is how we are well. So if we're stuck in a negativity spiral, which I have been, and maybe you are, we want to see if we can end that so we're not spreading it. That looks like avoiding gossip, because gossip absolutely erodes psychological safety, which is the first essential human need. We might want to try venting, but with consent, And I'm going to send you a PDF about this tomorrow, which is really about making sure we're not sliming each other with a lot of traumatic details, right? That we're asking permission before we share. Hey, are you in a position where you can receive this right now? Or are you really maxed out? So an understanding that we affect each other that way. You might want to just like start paying attention to complaining in general. I'm a world-class complainer, so this is no judgment for me, but often complaining really drains us. And so if you notice that after you complain, you feel worse, maybe you buddy up with someone and for a week you experiment with no complaining. One, it's really hard. And two, you might just find that you want to come to work because you'll feel better. That being said, there's still lots of problems and reasons to complain. So just get constructive about it using the zone of control. All right, we're really upset about this. What's within our control? What's the best action we can take, or who do we need to bring it to that does have control over this? And if there's nothing about this that we can control, how are we going to help each other cope with this? So this is really looking at how do you create a supportive microculture? Unless you are at the top, it's hard to control the whole culture of the organization, but we can start to influence it from the bottom up by creating smaller little cultures where you agree with 1 or 2 or 5 other people that you're going to practice some of these things together. Maybe you buddy up with one other person for that accountability about setting healthy limits or checking in once a week. Maybe you share your warning signs with them and you let them know that you want them to check in. And that looks like me seeing my friend Jen, and I know that Jen's warning sign is isolation, and I've noticed that she is very quiet this week. So I'm going to go up to her and say, hey, Jen, I noticed you've been real quiet and you told me that that's a warning sign. So I just want to know how you're doing. How can I help? Right? I don't have to feel awkward about checking in. It's not invasive because Jen gave me permission to say this to her. And sometimes we just need to listen. 5 minutes of uninterrupted listening is a very powerful gift. So no fixing, no advice, just empathetic listening. That goes really far. Our attention is a real gift. If we see someone struggling, we might just stand by and be that calm, steady presence for them. They know that we have their back. Maybe we do step in if someone is really struggling. They've flipped their lid. We know we need to step in. What can I do to help out? It's fun stuff too, like laughing together connects us and reduces our stress. Eating meals together, not just grabbing food from the break room, eating together helps. Listening to music and singing and dancing helps. So can you make some playlists that help to energize you or calm you down together that you might use on the job? So here's your 5th practice, and I'm going to send you a PDF that details this. The hot walk and talk is when you or someone else has flipped their lid, they're hot, you take them on a walk and you bring a couple of bottles of water and you allow that person to talk, or you talk if you're the stressed out person. And this helps them to flush out all that adrenaline and cortisol. They're sweating, they're drinking water, and they're talking, which is helping to bring their prefrontal cortex back online. This is very, very practical and helpful. And you can do it on the phone if you're, working from home. So in the last few minutes, I just want to talk about what the organization can do to create a healthier workplace. The research is clear that self-care is a critical part of your resilience, but it is insufficient on its own. We also need social support. That's an essential human need. And we need our organization to create healthy working conditions. And when all of that's happening together, that's when we really have the potential to be resilient in this work. So if you are in a leadership role of any kind, just know that your power magnifies the impact that you have on your staff. So if you are in a bad mood, if you are stressed out, if you are pessimistic about the future of the organization and what you can do, that is going to absolutely be highly contagious. Your staff is looking to you for cues of, are we safe? Are we competent? Right? Should we be calm or should we be panicking? So if you take good care of yourself, if you take your breaks, if you are well, if you're self-regulated, if you're realistically optimistic, that is going to lift everybody up on your team. Right? So your well-being matters. It will ripple out. Specifically, there are conditions that we want to look at that can reduce burnout. If anyone is interested, The Burnout Epidemic is a terrific book that came out, after the pandemic began. So it addresses that. And so the conditions for burnout are decreased control, decreased support, increased demand. So we're going to flip it. Increased control is allowing for some autonomy. Can you give your staff more choices around the work particularly when the work is emotionally taxing. So, sometimes we can't be the ones to make the euthanasia decision because we're too attached to that animal, or we've made so many decisions that day, we can't trust ourselves. Do we have the autonomy to say, I need someone else on the team to take this decision or be the one to perform the euthanasia, right? We need to be able to make choices. This is also important for anyone that's a high achiever because they're at highest risk for burnout. So can we make sure they have some control over the way that they work? I really encourage you to find some place in your organization, whether it's a trailer outside or a utility closet, that you can transform into a quiet place, a safe place for people to decompress so they feel a little bit more in control when they're dealing with big emotions, right? Instead of rushing to the next task filled with emotions, can they pause, go to that room, put that white noise machine on, there's maybe an essential oil diffuser, a comfortable chair, like do some of that deep breathing or let the tears out, because crying is a way to process stress. So we need a place just for small breaks to let it go. We can increase support. We need one-on-one reflective supervision where we help our staff reflect on how the work might be impacting them. So this looks like just getting to know each individual. What are they like? What's their baseline like when they're in the orange-yellow zone? If you know them that way, then you can be aware when their functioning starts to change, their behavior is changing, they're headed into orange or red, and you can intervene and say, all right, what kind of support do you need? Let's use zone of control. What choices do you have? And importantly, you can bridge them to care. So I'm not asking you to be their therapist, but I am asking you to pay attention to how the work is impacting them, right? Because it is an occupational hazard. So we have a responsibility to pay attention to their well-being and to help support them in doing their jobs well, which includes being able to care for themselves and manage some of these emotions. Bridging them to the right care is a very helpful thing. So you're not a therapist, but you can refer them to the EAP, to that maybe referral list that's been put together. You can make sure you're that warm handoff to someone who can help them. But that being said, it often takes time to talk with a clinician. Like it could be months before someone can get into therapy. So what most of us really need is the ability to talk in real time to someone safely to process some of what we're experiencing on the job. And your staff may just need to vent a little bit before they can make constructive changes. So what might that look like for you with the people that you support? Sometimes it is about bringing in outside support. If you have a veterinary social worker, can they give 75% to supporting the public and 25% to supporting the staff, having some one-on-one or peer debriefing? Maybe we bring in a grief or loss specialist. Please be really generous with appreciation. That's increasing support, making sure people know how valued they are. When people do not feel valued, it's one of the top reasons that they quit. So this is free and we can do this anytime. We can be authentic and timely with telling them what they are doing right. Do not wait until a review to tell them. Tell them in real time that you see them and you see the impact that they're having. Try to focus on celebrating the effort that they are putting in, which is what they have control over, versus the outcome of their efforts, which they do not have control over. And then decreasing demands, which really looks like how do we recalibrate our expectations of ourselves and each other and our goals for the next year? What are we able to do well when our functional capacity maybe is less than what it used to be? Our experienced staff might be very tired, right? A lot of turnover, a lot of chronic stress. New staff is still in training, so their competency is still building up. That means that you're not at like 100% capacity, even if you're fully staffed. So given the actual capacity of your tired staff or your new staff that's untrained, what is realistic for you to be able to accomplish right now? And then can you communicate those more realistic goals and expectations to them? So this looks like really acknowledging that for many workers, they are putting in a hard day and they still aren't able to get everything done. And many shelter workers are telling me that they go home at the end of the day feeling like a failure because they weren't able to do enough, right? It's never enough. They never feel like they're succeeding. And that absolutely leads to burnout because you feel powerless. You feel like you're failing all the time. So how do you redefine success? Success can't just be complete the to-do list if the resources aren't there to meet the demands? How do we help them prioritize? That's part of the decision fatigue, right? When we're exhausted, we can't figure out, like, what should I be doing with my limited time? I can't do it all. Can you help coach me to figure out what requires very high standards and I'm going to be held accountable to that? And when is it okay to, like, leave this to the bottom of the list, right? So I know I don't have to push myself really hard there. So that can take some of the cognitive demands off their plate. So to wrap up, I really want you to think about, what is it that you would like to practice after today? Just pick one thing before we sign off that spoke to you as something you want or need in your life, and then lower the bar and make it really easy for you to do that one thing consistently. No matter how small it is, if you're able to do it consistently over time, it will add up to real change. So don't make it hard, dig where the ground is soft, and just pick one thing today. So I'm going to recap how we practice compassionate badassery, how we show up with heart and courage, but also with wisdom about how we approach this work. We practice self-awareness, knowing how the work impacts us, staying aware of changes in real time so we can intervene for ourselves and each other, practicing self-regulation. We're aware of our stress response, and we're practicing those calming actions all day, every day, because we're really stressed out. We're practicing self and we care. We are aware of our basic biological needs, and we're doing whatever we can to meet them, and making sure our staff has time to meet those needs during the workday, and balancing the beautiful compassion that you have for animals with compassion for yourself. We're practicing shifting our perspective, intentionally connecting with the good and our impact, counterbalancing the difficult to sustain ourselves, always aware of what is within and out of our control. We have to invest in social support because we really, really matter to each other, right? So literally, let's save something for each other to bring our best selves to one another, right? That allow people to help you and offer help. And then take action as an individual and as an organization. Small things, baby steps, sustained over time will make a difference. So thank you for everything that you do. I know we don't cure compassion fatigue and burnout in a 90-minute webinar, so I hope that this offers you up some places to start and have a conversation together. There's a discussion guide that you can use so that you can talk to your team about, all right, that was great, we learned that, but what do we do? How do we put that into action? What does that look like in real life for us? Right, so I really encourage you to keep talking about it. If you have questions, I am here for them. And if you don't feel comfortable asking questions in front of your boss and coworkers, email me anytime, jessica@jessicadolce.com. So I don't know if there are any questions. We can just look at the chat real quick, but you're welcome to unmute yourself if there are. Oh, you're welcome. Yeah, adoptions. You're my people. You are so, so welcome, everybody. Thank you for everything that you do. You are a critical safety net for your community. Your community may not know it, but I know it. It's so important, the work that you are doing for animals and for people. So thank you for everything that you do and who you are. You're big-hearted and you're brave, and I really thank you for showing up. Yeah, thanks, everybody. Yeah, I use all this stuff in my personal life too, Lisa. So I don't think I missed anything. Oh, you're welcome, everyone. Okay, I don't want to go before, unless anybody is typing. If I miss anything, you will email me. Thank you for your time and attention today. Take really good care of yourself and each other and the animals. Be well, everybody. Thank you.